So picture this. You're out enjoying a beautiful afternoon walk, or maybe you're just wrestling with a familiar family pet right in your living room. And then, suddenly, between the tail wags and the playtime, the completely unexpected happens. A loud noise, a quick movement, and in a fraction of a second, you're bitten. It is a high adrenaline, genuinely terrifying scenario, and it's one that actually sends over 4 million Americans to the doctor every single year. Welcome to This Explainer. Today, we're going to unpack the exact medical protocols you need to know. We'll discover what emergency medicine guidelines say about protecting yourself and your loved ones during those critical, incredibly fast-moving moments right after a bite.
So, you've just been bitten. Now what? Well, let's dive right in. The immediate aftermath of a dog bite is, frankly, pure chaos. Your body instantly goes into full fight-or-flight mode. Your heart rate absolutely skyrockets, and this massive surge of adrenaline floods your whole system. And because of that intense chemical rush, you might not even feel the true extent of the pain right off the bat. Your very first instinct might be to panic, or maybe to reach out and try to grab the dog, but you've really got to resist that urge. Your absolute primary objective right now? Put distance between yourself and the animal to eliminate any chance of a secondary attack.
And look, I really want to validate the physical trauma you've just experienced here because a dog's mouth is literally built for gripping. Dr. Jasjot Johar, who's an emergency medicine specialist, hits the nail on the head. He points out that even a small to moderate dog bite can be very painful because of how it tears and crushes the skin. You see, dog teeth don't just puncture cleanly like a needle. They grab, they compress, and they tear that underlying tissue, which creates a really open, jagged wound. So in this chaotic moment, you need to take a slow, deep breath, get yourself to a safe location, assess the situation, yell for help if someone's nearby, and get ready to take some immediate medical action.
Which brings us to the most critical phase, the crucial 15 minutes right after the bite.
What you do in this immediate aftermath really dictates how your body's going to heal and whether you'll face severe complications down the road. And the number 15? That is going to be your absolute best friend right now. Medical experts totally agree that what you do in the first 10 to 15 minutes can drastically lower your chance of developing a serious infection. Think about it. Any dog bite that breaks the skin is essentially injecting bacteria directly into your tissues. So your absolute top priority, before you do literally anything else, is to get to a sink. You need to start washing that wound with warm tap water and mild soap for a full 10 to 15 minutes. Just let the water flow directly into the wound to flush out all that dirt, debris, and canine saliva.
Now, here's what's actually really interesting about this, and it kind of goes against everything we were taught as kids. You know, when we get a scrape, our first instinct is usually to run to the medicine cabinet and grab hydrogen peroxide or rubbing alcohol to quote-unquote kill the germs. But doing this with a dog bite, it's actually a massive mistake. While those harsh chemicals definitely kill bacteria, they also severely damage your own healthy tissue in the process. And that slows down your body's natural healing timeline and can lead to significantly worse scarring. So seriously, skip the chemicals. Just stick to plain soap and copious amounts of water.
Okay, so your immediate action plan should look exactly like this. Step 1, wash for that full 10 to 15 minutes like we just talked about. Step 2, control the bleeding. Once the wound is nicely flushed out, grab a clean cloth or some sterile gauze and apply firm, direct pressure. For most minor, shallow bites, this is going to stop the bleeding within just a few minutes. And then, step 3, apply a nice, thin layer of over-the-counter antibiotic ointment to the area. This acts as a barrier, and then you just lightly cover the whole thing with a sterile bandage.
All right, moving right along, we enter what I like to call the crossroads, the next 8 hours. Let's see how this situation builds. You've done your initial first aid, the bleeding has finally slowed down, and now you have a major decision to make. Do you continue managing this at home, or do you need to rush straight to the emergency room? Emergency physicians strongly advise that you must have a medical professional look at a concerning bite within 8 hours. Waiting any longer than that, your infection risk just absolutely skyrockets. Now, you can probably manage it at home if it's a minor level 2 or level 3 bite, meaning, it's small, it's shallow, the bleeding stopped fast, and the skin isn't gaping open. But you absolutely must seek urgent ER care for level 4 or 5 injuries. If blood is gushing, if the wound is so deep you can actually see fat, muscle, or bone, or, and this is key, if the dog was a stray acting strangely, go to the hospital immediately. Also, I need to point out that bites on the hands, feet, or face are incredibly dangerous. The human hand is packed with this super complex anatomy of tendons and joints, right? An infection there can spread like wildfire and actually cause permanent loss of function. And face bites, those often require professional stitches for both proper healing and, of course, cosmetic reasons.
Before we move on to the microscopic threats, let me ask you a quick question, just to test your first aid instincts. Let's say you have a moderately deep bite on your leg. The bleeding has stopped, but the wound itself is pretty jagged. Should you use medical tape or maybe those butterfly bandages to pull the skin tightly shut before you wrap it up? The answer? Absolutely not. You should never, ever tape a dog bite tightly shut at home. As Dr. Johar explains, emergency doctors often purposefully leave dog bite wounds open so they heal on their own. Why? Well, tightly sealing a puncture wound creates this dark, warm, oxygen-deprived environment, and unfortunately, that is the exact perfect breeding ground for the bacteria that the dog's tooth just shoved deep down into your tissue. You want to lightly cover the wound to protect it from outside dirt, sure, but you definitely do not want to trap that internal bacteria inside.
And that brings us to the invisible villains that show up between 24 and 48 hours later.
This right here is where the invisible war really begins beneath your skin. Shifting our focus from the physical tear to the microscopic threat, the next 24 to 48 hours are when the real villains emerge. Even if a bite looks relatively mild on the surface, a severe bacterial infection can erupt incredibly fast within this window. Roughly half of all dog bites introduce a toxic cocktail of bacteria right into the human body. We're talking about your common germs, sure, like Staphylococcus and Streptococcus, but we're also dealing with highly specific, really aggressive bacteria. There's one called Pasteurella multodicida, which is a fast-acting pathogen that frequently causes wounds to get infected within the very first 24 hours. And then there's Capnocytophaga candimorsis. Try saying that 3 times fast, right? It's a fastidious bacterium found in the mouths of nearly a quarter of all dogs. For patients who already have weakened immune systems, this specific bacterium can be completely devastating, potentially causing serious issues like septicemia, meningitis, and endocarditis.
To truly emphasize just how serious this is, let's look at the guidance from Dr. Stephen Sales III over at the Cleveland Clinic. He bluntly warns that infection is the #1 concern following a bite. If you're at home and you start seeing increasing redness, severe swelling, maybe you feel heat radiating from the bite, or if you develop a fever, or worst of all, see red streaks spreading up your arm or leg, you are officially in a medical emergency. You absolutely cannot tough this out at home. You might actually need immediate hospitalization and heavy-duty intravenous antibiotics just to stop the spread.
But hey, it's not just the bacteria from the dog's saliva that we have to worry about, it's also the bacteria from the environment. Let's bust a huge medical myth right now. Most people think you only get tetanus from, stepping on a rusty nail in some abandoned barn somewhere. That is completely false. Tetanus bacteria live everywhere, in everyday soil and dirt. So a dog that's just been happily digging in the yard can super easily carry tetanus spores on its claws or right in its mouth. And those spores, they can enter your nervous system through a tiny pinprick, a scratch, or a bite. And that can lead to a disease that is very often fatal if it goes untreated.
Which is exactly why your doctor's going to ask about your vaccination history. While kids routinely get their tetanus shots, adults are supposed to get a booster every 10 years. However, and this is a really vital distinction here, if you suffer a dog bite or any dirty wound and it's been more than 5 years since your last tetanus shot, the standard medical protocol is to just give you a booster immediately. They need to ensure your immune system has those antibodies ready and waiting to fight off any potential spores. Now, we have to talk about the ultimate threat, rabies. While bacterial infections and tetanus are definitely dangerous, rabies is the ultimate threat. It's a viral disease that literally attacks the central nervous system. Now, thankfully, it's exceedingly rare in domesticated dogs here in the US today, mostly thanks to vaccines. But if you are ever bitten by a stray, an unvaccinated pet, or a wild animal, the stakes quite literally couldn't be higher. Because once clinical symptoms of rabies actually appear in a human, the disease is essentially 100% fatal. Looking at the World Health Organization's top 10 considerations for rabies post-exposure prophylaxis, or PEP for short, we see our golden rule sitting right at the top. Number 1, wounds must be immediately washed and flushed for 15 minutes. And number 2, anchors the global stakes. Rabies PEP must be instituted immediately using safe, effective vaccines and immunoglobulins. You simply cannot wait and see if you develop symptoms. It's just not an option. If you're exposed to a potentially rabid animal, the PEP protocol is a mandatory, literally life-saving medical intervention. And it's really important to note that modern rabies vaccines are highly purified and incredibly safe. According to those WHO guidelines, there are literally 0 contraindications for receiving rabies PEP. None. Because the alternative is a fatal disease, this treatment is safe and absolutely required even if you're pregnant, for infants, or for immunosuppressed individuals.
So what does this treatment actually look like if you end up needing it? Well, it's a pretty grueling, multi-week timeline. If the dog is unverified or actually tests positive, your treatment begins on day 0, which is the day of your hospital visit. You'll receive human rabies immune globulin, which is infiltrated directly into and around the bite wound itself. This provides immediate antibodies. Plus, you get your first vaccine dose right in your arm.
After that, you're going to have to return to the hospital for additional vaccine doses on day 3, day 7, and day 14. It is definitely a serious commitment, but here's the good news. It is 100% effective at preventing the virus from taking hold, as long as it's administered promptly.
We share our homes, our streets, and our everyday lives with dogs. They bring us an immense amount of joy, but at the end of the day, they're still animals driven by instinct. So are we truly prepared to respect the unpredictability of man's best friend? Knowing exactly how to react, understanding that golden 15-minute window for washing, knowing when to rush to the ER, and deeply respecting the silent threats of bacteria and rabies, that is our absolute best defense. Education and swift, structured action quite literally save lives and limbs. So respect the animal. Respect the medical protocol, and please stay safe out there.